Thank you. Welcome, everyone. BC Transplant is pleased to co-host, along with BC Renal, BC Kidney Days. And it's great to have everyone together, to learn about the best practices and the great and amazing work that you do within BC as well as outside of BC across Canada. I'm just going to spend a few minutes just to also recap and review what BC Transplant is up to these days. And if I can go to the next slide, please. So we are undergoing some program planning, and with any plan, you need to know what you're doing. And so our first three goals are more the patient-focused goals. So we want to optimize our donation pathways, and then our surgical outcomes, and then obviously take care of patients both before and after transplant. In BC, we currently have around 770 patients on the wait list, of which 80% are kidney patients, so it's about 650 patients. We also have about 5,400 post-transplant patients that we're currently taking care of together. The other four goals around making sure we have a great workforce and health partners, we're supporting each other nationally, and that we have a great program infrastructure. And finally, what we're here today is to foster a culture of education and research. We just had our BC Transplant Education Day, and it went very well, and this is going to go great as well. Next slide, please. So as everyone knows, we're all impacted by COVID, and this is just a national view of how things are going. The dotted line, sorry, it's a little faint. This work was done by our partners at Canadian Blood Services. The dotted line is what the trajectory should have been, and the solid lines is where we're at. And as you can tell, there's a significant decrease. This slide was done in August, and I think since that time, there's been some improvement, and I'll just share with you what's actually happening in BC. Next slide, please. So this is the blue line is 2019, and you can see that it kind of hovered around that dotted line, but for this year, we had a dip, and now it's picking up. Last year, we had 480 transplants. This year, we are projecting it's going to be around 411. Luckily, with our projections, we can change them, and we don't have to do any recounts, but it's around 14% less than last year is what we're tracking. Next slide, please. Of the 480 transplants, about 70% of those are for kidneys. And you can see the difference, and of those, about a third are from living kidney donors. So we are certainly being impacted. In fact, for living kidney, we had to stop for a little bit, but as you can see, things are picking up. We believe that by the end of the year, again, another projection, we're hoping for around 250 kidney transplants. So that will be down. It's around 25% down compared to the last year. So I know everyone's working hard to continue and complete the transplants. And again, thank you for the team. Next slide, please. So with COVID, I think as everyone knows, we've had to make many adjustments with virtual visits, develop guidelines. We had our two lead nephrologists, Owen Johnson and Jag Gill, also help with guidelines. We've had to look at different ways of transporting organs, including kidneys, and other ways to keep in touch with our patients. In terms of what we're doing for our program and system improvements, it's not on the list, but we have an initiative together with BC Renal called Transplant First. And what we're trying to do there is essentially do preemptive transplants, pre-dialysis. So that's an exciting project. We've had to also we're working on other guidelines for our donors. We're trying to expand our donation and having the option for during a MAID patients. And we're also expanding our Hep C donation to beyond kidney to include heart, liver, and lung donors. And finally, one of the projects we're working on is to optimize ORs for the daytime. Next slide, please. So with COVID, we've had to do a lot of things virtually to keep in touch with our patients. We have a strong community engagement work. So on the far right is we have a Green Shirt Day. This is a donation awareness to honor Logan Boulay, the one individual that passed away. In the middle, we have Transplant Heroes through the Gratitude Rock Gardens that we have presented. In the middle bottom is where we're trying to do more promotion to encourage social distancing. And on the left, bottom left, is a new program called Direct Contact, where we're helping donors and recipients families, donor families and recipients get in touch with each other directly. So it's a really exciting work there that our team is doing. Next slide, and my final one. So again, thank you for participating. I want to thank all the presenters, and we look forward to learning from you. And finally, thank you for the organizing team, and including our BC Transplant in this event. Thank you.